COVID data, it turns out, isn't being well tracked. The co-president of National Nurses United drops by, Jean Ross, to talk all about it. Check it out, leave your comments, ding the bell, share it with your friends, and subscribe to our channel. And welcome back. Thom Hartmann here with you. And on the line with us is Jean Ross, an acute care nurse and co-president of National Nurses United. NationalNursesUnited.org is the website. And National Nurses is the Twitter handle. Jean, tell us about, you would think that during an epidemic that the public health services of the United States and of the various states would be working really, really hard to get really good, clean data on what's going on so you can do your best to mitigate and, the damage of the pandemic and solve the problems of people who who are exposed to this. What's actually going on?
Well, as you probably have read in our Sins of Omission report, we need data that's transparent and accurate and timely, but what we're running into is data that's been neglected, it's been hidden, and it's been manipulated politically to give people outcomes they want. And of course, our practice is based on science, and the virus doesn't care how you report it. The virus is going to do what it's going to do. So with this piecemeal patchwork system we've got here, instead of a real public health care system, our nurses and other healthcare workers are dying, and they're dying in large numbers, and we apparently have been the only ones keeping track of it.
I remember a month or so ago that I had read a statistic that over 1,000 doctors, nurses, and other frontline healthcare professionals had died. Where are we at right now? Well,
the estimate that we have is probably tragically underreported too, because of the data being manipulated. We think 1,718 healthcare workers, and that includes RNs. So 213 of those are RNs. And of those, 58.2% are nurses of color, 124 of them. Mm. So even in our profession, which is just, like a quarter nurses of color, they still are dying in larger rates than people in the general population.
That's mind-boggling. So what should we be doing?
Well, what we need is, I actually have a list for us here. We need daily reporting of data, and it has to be cumulative totals. And it has to
Didn't we used to have that? Forgive the interruption, but didn't we used to have that?
The CDC, when it was under the CDC, yes, but they've taken it away from the CDC, Center for Disease Control and Preparation, and they have given it to private companies, two in particular that we know of. And then they sign these non-disclosure agreements, and so they say everything is proprietary, so the public can't know, we can't know. Those of us that are getting sick and dying can't know. And so, yes, we did used to have that. We need daily reporting on healthcare worker infections and deaths, both at an establishment level, like the hospital or business. And then we need data on symptomatic cases. We've got employers that are like, no matter what your symptoms are, if you tested negative. And keep in mind, I've never heard yet of a false positive. I have heard of false negatives because the tests are not standardized. And depending on what time you test a person, they may test negative, but they really are in the throes of infection. So we need that data. We need to know how many people are hospitalized. The deaths have to be reported at national, state, and county levels. We need to know the hospital capacity data, and again, at those three levels. And it has to be updated in real time. It has to include total and available beds, and by type, like ICU, med-surg, telemetry. We have to know staffing. We have to know healthcare worker exposures and infections, what we call hospital-acquired nosocomial infections, patient infections. We need all that, and we do need data on the stock and supply chain of the essential PPE, the personal protective equipment. That has to be reported to it. And more than anything, we need this president to invoke the Defense Production Act and to do that temporary emergency infectious disease standard so that employers will be told you must have these protections in place if you expect your nurses and other healthcare workers to show up on the job and deal with patients during this time of the COVID pandemic.
We're talking with Jean Ross, the co-president of National Nurses United, nationalnursesunited.org, of course, the website, about the widespread failure to track and report data on COVID-19 deaths, testing, and infections. Am I correct in assuming, Jean, that there is literally no public health explanation for why the Trump administration and a number of states are choosing to conceal or otherwise make unavailable this information, that the only possible reason is that Trump doesn't want things to seem as bad as they are, so that so that people will feel good and go out and vote for him in the election?
Our deduction is that there's that, but there's also this either or, the economy or the health of the public thing that they've set up. And what's really sad is you will, like other countries, get back to the economy that you want faster if you do these things we're talking about. And that's why
Right.
Scientists, doctors, us nurses are exhorting people, please, you listen to us when you're ill, you trust us, please do these things, and then you can get up and running. But the way things are now, it's going to hang around for longer and longer. We are going to continue to lose more people than any other country on the face of the earth because of the refusal to listen and do the right thing.
Yeah, it's damn breathtaking. Jean Ross, the co-president of National Nurses United. Jean, thank you so much for dropping by, and keep up the great work. Thank you.
Thank you.
And check out nationalnursesunited.org. Check out their website, and it's